Hello, I'm Denny Michaels, co-founder and CEO of MILA International. We're here today to talk about injection ports, which are needle-free. They're also called stasis valves. And at your practice, you may also call them bungs, PRNs, or just plain adapters. But if you do so much as put in little peripheral IV catheters or bigger jugular catheters, be they single lumen or multi-lumen, you need to know the details about this injection port. The one I have in my hand is the stasis valve in its simplest form. And what this does, as in its simplest form, it can screw directly onto an IV catheter, like that. So you can take a syringe, push it in through a split septum, and that allows you to draw blood or administer drugs. What you're more accustomed to seeing, I believe, is putting an extension onto your peripheral IV catheter. And a lot of folks will use the T-set. And this is the old-time injection port. You can still put a needle in that, but gradually you'll see this T-port, this piece, be replaced by needle-free as well. This is what I'm talking about as far as the needle-free port. And this is a tethered cap. It's not required that you use this. This needle-free valve that I'm going to tell you about is completely sealed. You don't have to worry about dirt getting on it. But because these were invented for humans, and as we know, animals sometimes get a little diarrhea, whatever, onto their instruments, we put that on there just to be nice and clean, nice and clean. So you can pop it on when you're not using it, but you can also cut it off if it's in your way. Don't worry. When you go to use this port, you want to use proper hand cleaning. Put your hand sanitizer on, or wash your hands. Let that dry. I'm going to go through this a little bit faster than I would in a clinical setting, just in the interest of not boring you. And I'm going to take an alcohol swab. And then the protocol is to swab this flat surface. There's a little split septum there. You swab this for 15 seconds aggressively. And then you will take your sterile syringe. You can use either the slip lure or the lure lock. First I'll do the lure lock. You screw it in, line it up, push it, screw it in, and like I said, push, pull, or push. And how does that work? You're not trying to get this surface sterile. It's not really coming in contact with the inner part of the syringe. Just to explain it very briefly, there's a blunt cannula inside there that goes up inside here, and that's what creates that dedicated fluid path, so that the outside of this is never really in contact at all with your medication or your fluids. The other syringe, the slip lure, or even an IV set with the slip on the end, can work just fine. But I'm going to show you what not to do. Don't do this, because that can slip out of there very easy. Put it in, give it just less than a quarter turn even, and then test it. And it feels quite firm, and then you can go ahead and take care of your procedure.